Hey, this is Marty Stepniak, Senior Writer for Hospitals and Health Networks, reporting from the H&HN Executive Forum here in Chicago, and I'm joined today by Ashley Thompson, who is Senior Vice President of Public Policy Analysis and Development for the American Hospital Association. Ashley, thanks so much for being with me today.
Thank you so much for having me.
We're here to talk about a couple of the key policy issues that are plaguing the hospital field. One of them is marketplace instability. Could you talk a little about that issue and a few of the remedies that the AHA hopes for to address this?
Sure. As many of you know, some very large insurers have pulled out of the exchanges. So United pulled out of the markets, and recently Aetna started pulling out of the markets, and that has left many markets across the country that may have 0 or 1 insurance plan to choose from. And this creates a huge access problem. So we recently wrote a letter to Secretary Burwell with 5 recommendations on how to shore up the exchanges. One of them is a technical thing around risk adjustment, better make sure that we know what types of patients are being served healthcare. The second one has to do with the special enrollment periods and closing some loopholes around that. The third is to allow third-party payments of premiums by charities or other organizations for people who seek health care. The fourth one is to do more outreach and education so that we can enroll more people in the exchanges, including the young and the healthy. And then the fifth area is really to look at working with the state insurance commissioners to make sure that they do appropriate rate setting moving forward.
Another key concern for hospitals has been the rising prices of drugs. The AHA recently commissioned a study related to this topic. Could you tell us a little about what you found in that analysis?
Yeah, AHA has spent the past year really looking at the increased drug pricing issue. And so we worked with the Federation of America's Hospitals and commissioned NORC out of the University of Chicago to really look at the rise of inpatient drug spending among hospitals. And what they found is that over a 2-year period, based on a per admission basis, inpatient spending for drugs rose 38%, which is a huge amount. They also found that this is impacting hospital budgets because they're paid under a DRG or fixed-based system. And they found that it wasn't just brand name drugs, it was generics as well. It was interesting to see that it wasn't those very expensive drugs that were increased a lot, but it could even be the small cost but huge volume drugs that were really impacting hospitals' budgets.
One other public policy issue I wanted to bring up is regulatory burden that's being placed on hospitals right now. Could you talk a little about the weight that hospitals are feeling from all these regulations that are coming at them right now?
Yeah, the AHA policy team has counted almost 18,000 pages of new regulation in the Federal Register since the beginning of this year. It's mainly proposed and final rules. It actually doesn't even include sub-regulatory guidance or policy that's made via blog post, as Administrator Slavitt did earlier this year when he said, pick your pace related to MACRA. So the amount of regulations that are coming at our members is just tremendous. And given that this is the last year of an administration, after an 8-year time period, due to legacy reasons and trying to get things out the door, we expect even more before the end of the year. AHA has put all of this into a number of buckets that we're looking at. So for example, delivery system reforms. There's so much coming out of the Centers for Medicare and Medicaid Innovation. And while we support much of it, with all the changes to ACOs and MSSP track 1 and 2 and 3 and next gen, we think that the pace needs to slow down. It's too much too soon, especially when the bundles that have come out have been mandatory related to hip and knee and cardiac. We also think that the number of quality measures that are out there is completely overwhelming, and we want them to focus on an initiative to really identify those measures that matter. There's also changes related to HIT for meaningful use, stage 1, 2, and 3. All of this is very time-consuming for our members. It requires a lot of work from them. And so we're undergoing an initiative to really re-examine how much time is taken away from patients in order to comply with these regulatory burdens. And we'll go under a grouping of that, and we plan to roll that out next year so that hopefully we can influence the next administration to kind of take another look at what they're doing in this front.
That leads right to my next question. You know, we have a new president coming into the White House, and the next couple of months. Could you talk about what the AHA plans to do to reach out to him or her and put some of these issues in front of the next president?
Yes. So first, you should know that we've been working with both of the campaigns, both on the Republican side and the Democratic side, both their policy teams and their transition teams. But what we will do during the transition is continue to meet with them to press AHA's issues, to talk to them about what issues are top of their mind, to talk about their political appointees and perhaps give some suggestions. And as part of that, we're putting together what we're calling a Dear 45 letter or memo to the president, because it will be the 45th president of the United States. And as part of that, we have a short summary of kind of the key issues that AHA cares about. And then we have an attachment that will be all of the issues in our 2017 advocacy agenda. Many of them have to do with promoting access to care, supporting delivery system transformation, improving quality and patient safety, increasing affordability, of which regulatory burden is part of it, along with a host of issues.
Ashley, thanks so much for being with me today.
Thank you so much for having me.
For H&HN, this has been Marty Stempniak. Thanks for watching.